Hi, folks. Kim Archambault, Executive Director of Sterling Village Skilled Nursing and Rehab Center. I'm coming at you with an update today on Tuesday, the 26th of May. Um, our census today is 121 people in the building. Our total number of residents that have tested positive this entire time is 74. Our total residents who are on our isolation unit as of today is 45. Total new positive residents in the last 24 hours is 3. Recovered residents is still at 20. We do have 3 people coming off either today or tomorrow. We are making some bed moves to put some additional people on the COVID unit and other people come off the COVID unit. But until the other rooms are fully cleaned and I'm not going to count them. So we will do that tomorrow. Number of residents that have passed away in total is 8. We had 2 this weekend that unfortunately had passed away. And total staff is still at 14. Nothing has changed there. Everybody in the building has been tested, including twice or 3 times with some residents. A lot of people have questions in regards to why are people retested or why are people where they are in the building. So on our Birch unit, we have 49 beds. When somebody is showing any form of symptoms, both that person and their roommate have to be on precautions because they've been exposed to each other. We do the testing on the person who has the symptoms, and if they're negative, then they both come off of precautions. If they test positive, then they get moved to an isolation unit, and we still observe the other roommate to see if they're showing any signs or symptoms or not. If we do get more than 2 positive people in one unit, we've tested the entire unit. If somebody's turned up negative, sometimes we do a secondary test because it could take up to 14 days for them to even show positive symptoms. So you have to be really careful with where we're putting people because we don't want to expose people that wouldn't typically be exposed besides moving people around. Also, if anyone was on the Birch unit and tested negative, we didn't put them right into general population. We put them into a second isolation area with the other residents who were either negative, but we know had known exposure, or if they were coming off of isolation precautions, they went to maybe this step-down unit, and then we needed their bed for a positive patient. So we're trying not to go bigger than the unit that we have with positive patients. We probably have 30 some odd patients coming off of isolation by Friday. So we have to talk about that, the director of nursing, assistant director of nursing, the infection preventionist, staff developer, to see are we going to move them off the unit because they're not going to catch anything by staying on there a little longer if other patients are going to come off in a few more days. Or do we take the then positive people and put them into our 6 beds in our step-down unit and make that the new isolation area since we're going to be down to minimal numbers of people that will be positive. The folks on Aspen unit, they're doing great. They have not been exposed. And we don't have anyone showing symptoms, knock on wood for that. But we also have some folks that really want to go outside, and we just can't do that. We have to treat everyone the same. And some of the people whose rooms face the courtyard may not understand why some people can go out and they can't. So as much as people want to enjoy the day, as I've said before, we just can't do that. We have to be fair and treat everyone the same, even if people aren't positive. And I think people are understanding that when we explain it to them. I had a few phone calls today, and I feel like I'm a open book, if you will, and I will tell you anything. I do feel that if some people want to call and ask questions as to why we do things the way that they do them, that we do them, I'm happy to explain that to you. But when somebody may say, I think you're doing it because of this, it does get a little bit under my skin, because I feel that, we wouldn't do anything but the way that we should, ethically and by regulation. We take care of these people, and anyone that is in this facility does not want to be in this facility. There is some people that may have a really good quality of life here, but you and I aren't waiting until we turn 70, 80, 90 years old, or have a traumatic life event that puts us in a skilled nursing facility for the rest of our lives. A lot of people, if you ask them where they would want to live, this is not their first choice, is what I'm getting at. So with that being said, we need to give them the best day possible. And in no way, shape, or form would we ever jeopardize their health. Would we ever jeopardize their mental well-being? Or would we jeopardize their freedom or independency as best as we can to our ability? So, if you want to call and ask me a question, I'm happy to give you an answer about anything. If you want to ask why we do what we do, if you want to ask me that you've heard things in the community about regulations or how things work, or about monies that come in from the government, feel free and ask me, and I will let you know how that works. I can give you paperwork and show you how the government funds work to get staffing in the building, to stay in the building, and to even get the protection equipment in the building. So that being said, I want to again thank the staff. I've heard of many facilities in the area that have had the unfortunate issues of staff not showing up to work because they're scared, they're nervous, they might be not fully educated on the risks, the benefits, how to handle things, PPE. I don't know. I can't speak for them. I can only speak for us. But our staff has just been truly amazing. No one has not shown up for work. Nobody has walked out to say, I'm not going to take care of my patient. And I think that that speaks volumes for how much they care about these people, and also how much they value their work here that they do. We did order over 100 phones. We had 16 come in. Those were put into rooms. That was another topic that was asked about again today. It's getting frustrating having one cordless phone on each unit. I did pick up a phone that my daughter is bringing down to the building that has 3 handsets, if you will. So I'm going to have one nurse keep a handset on their cart at all times, which will be for them not to go in a patient room, so that if a patient is on that phone line and they hang up, if a nurse is in the middle of a treatment, if they're doing a medication pass, they may not remember to go back to that room and get it. The person using the phone may not remember to hit the bell to let somebody know that we can take the phone back and clean it down for the next person to use. So we will get those set up, and hopefully that system works better. We did get notification that the remainder of our phones should be coming in by Thursday, so hopefully that works. I was also going to have the folks in activities maybe do phone calls because they're not doing group activities at this time. So a lot of information in one message kind of makes up for yesterday, and I will absolutely get you more answers as the questions roll in. So have a great day, and we hope to get this smoothed out even further. Thank you. Have a great day.